Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students through retirees and anywhere in between. Today, I'm very, very pleased to welcome Valerie Creel. Valerie began her healthcare journey in 2007 when she took emergency medical technician courses and began working on ambulances. This, she says, created a foundation for her nursing career. Valerie became an RN in 2013 and went straight into a new grad program in a critical care unit that specialized in neuro, medical, and was a level 2 trauma center and ICU. She continued to grow as a nurse and learned as much as she could, becoming trained in multiple modalities such as therapeutic hypothermia, CRRT, and more. With the onset of the COVID-19 pandemic, Valerie continued working at the bedside while doing freelance writing on the side and getting her BSN. She also earned her critical care registered nurse board certification at this time. Valerie is currently a legal nurse consultant, and she has a new business, Bridgepoint Legal Nurse Consulting, LLC. So, welcome, Valerie.
Thank you so much for having me today. I appreciate it.
You have done such a wide variety of things.
Yeah.
It is awesome. It is awesome. 2007 is what? A few teen years ago.
Yeah. Almost 16. Oh my gosh.
Almost 16 years. And in those 16 years, you have done so many things. What was it though? You say that your EMS career, laid the foundation for nursing. So what actually drew you to the healthcare system in the first place to become an emergency medical technician and then a nurse?
So that's a really good question. I actually worked in the mortgage industry before I was a healthcare provider. And healthcare wasn't even on my radar, actually, because I was always very squeamish. Which is really funny considering the specialties that I got into. But I started looking at other careers because I wasn't really happy doing the 9-to-5 corporate work for a couple of years in my early 20s. And decided that I really liked helping people. I really liked science. I wanted a career that I could help people where they needed it most, in those moments that they needed someone there. And I was drawn to emergency medicine, realized that being squeamish was something that I could get over, and I quickly did. And it became a very rewarding career. So I wanted to make sure that I could do EMS because I figured if I could do EMS, then I could do nursing, no problem. And that's how it
worked. You talk about being squeamish. I actually think that a lot of us are squeamish. The funny thing is that we're not squeamish in the moment.
Correct.
Perhaps before, perhaps after we go, oh my gosh. Yeah. In the moment, it's like, get out of my way. Let me take care of this.
Exactly. And I'm glad that you brought that up because that's exactly how I would compartmentalize it. One of the first moments that I had that I realized I wanted to be an EMT was when I was upon a motorcycle accident on the side of the highway, and I saw the EMS providers respond. They were a flight crew. It was a rural area, and it was a really complex trauma. And I was just fascinated by the fact that they were able to take this really horrible situation, handle it. They knew exactly what to do. They got in and got out, and I looked at that and I said, that's what I want to do. And I realized if you have something really scary, but you have steps to follow to handle it, it takes the anxiety and fear out of it. And I just wanted to do that. So I just learned as much as I could about how to handle it and realize that nurses and healthcare workers are good at compartmentalization and just got really good at that. So.
Yeah. And in that, you mentioned the steps. In that moment, the steps just fall into place.
Yep.
You don't even have to really think it through. It just comes. You just do it.
Exactly. And you just become focused, and it's kind of going to the eye of the storm. And
yeah.
Where I do best clinically.
So Okay, so you got over the squeamishness and all of that. Or I'm not sure if we ever really get over it, but we manage it. Um, what any other challenges for you? Because going from EMT to
Mhm.
nurse is a bit of a shift.
Yeah.
Any challenges for you?
Yeah, going from EMS to nursing is very different because your patient interaction time is so much shorter
Yeah.
with EMS. You are with patients for the duration of transport, sometimes an extended time on scene, but overall, you're not spending days with patients like you are in ICU.
Right.
So it was a different way of approaching care. And when I was in my new grad program, I think one of the biggest challenges that I faced was handling end of life care because we weren't really prepared for it at all in nursing school. And when they asked us what our challenges were in our new grad program, that was what all of us brought up
Hmm.
because it's such a complex, important time. And it ended up
Yeah.
being something very rewarding after I learned more about it. But that would probably be my biggest challenge initially.
Yeah. 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 You get to the place where um you actually feel privileged to be there
Yeah,
at that time.
absolutely. It is
Yeah.
a privilege. It's something that the family will always remember. It's something that you have the opportunity to provide dignity and care that a person deserves in that time, and it's an honor, really.
Yeah, it really is. I absolutely agree with you there. I absolutely agree with you there. So I was reading through your bio, and you have certifications in things like strangulation. And I have to tell you, I didn't even know you could get certified in strangulation.
So that was a certification or education that came much later. When I became a legal nurse consultant, I was hired by a nurse that specializes in criminal matters. And I saw all of this, the certifications that she had, or all the training that she had. And I was like, how do I get as much of this as possible? Because this is fascinating. And I found, or she led me to this organization called the Alliance for Hope. And they're based out of San Diego. And they do a month-long training that teaches you everything that you need to know about the forensics of strangulation, all of the medical aspects of it, the profile of the person doing strangulation, victims, and it was all encompassing and it really helped me understand the medical components of it so I could analyze
Right.
cases that involve strangulation and just everything about it. And it's one of my favorite topics to review
It sounds
cases.
fascinating.
Yeah. They offer the trainings twice a year and I highly recommend it for looking into it.
Sounds fascinating. I was like, oh, well, how does one do this?
Yeah.
Okay.
Yeah, because strangulation and hypoxia go hand in hand. And as nurses,
Yeah,
we deal with hypoxic patients all the time. So it
all the
was just
time.
looking at the physical signs and symptoms of it and correlating it to how someone presents in a criminal case.
That's a big thing. That's a big thing.
Yeah.
I've got to do some reading about that because I read it and I thought immediately my antenna went up and I thought, this looks so fascinating. How does one do
Yeah.
this?
Yeah. Yeah. It's very fascinating. I really enjoy.
So, having done all of that, you came to it, you came to nursing with a whole different background, different skills. You were in the mortgage industry, you became EMS, you became a nurse. That brings a different perspective than someone who comes out of school and goes straight into nursing,
Yeah.
right? So, what would you like to see? What would you like to see change? Let's start there.
I think that there is a big gap between what nursing school prepares you for and what real life nursing is like.
Mhm.
I also think that there, in the past, has been a like nurses eat their young mentality. And I think that that is so toxic and not helpful. And that's one reason that I really enjoyed precepting nurses that were new grads because I was really trying to break that um, kind of culture, even if it was just with one or two nurses, because I think it's so important to prepare your colleagues to stand alongside of you and feel confident in emergencies versus feeling scared that they're going to make a mistake and scared to be accountable for things that happen. I think that everyone should deserve to feel supported in a field like nursing because it is so crucial and because we are so short-staffed. And I just think that it's just better for everybody, you know?
I know, I know. We talk about this nurses eat their young thing so much. And I have wondered where this all started or what brought this about.
Right.
Um, I've come to the conclusion that it comes out of insecurity.
I agree.
Basically, it's just insecurity. Healthcare, and especially in the last 15, 20 years, when healthcare, nursing, all kinds of things is just changing so rapidly. And I guess many people feel like they can't keep up or feel threatened. Some people do feel threatened by people just coming out of school, nursing students just coming out of school, saying, well, they taught me this differently in nursing school
Yeah,
and all of that kind of thing. And I wish we could get rid of um, that barrier, because it is a barrier. Maybe somehow in our education we can deal with it, but a lot of it, I think, is insecurity.
I agree. Yeah, and I think it's also just a disconnect between current practice and healthcare culture, and the hospitals, I feel like, have a lot of room for improvement, especially after COVID. And there's just a lot of things that need improvement within healthcare.
Yeah, yeah, yeah. I don't even know how we're going to improve, because healthcare is one massive conglomerate.
Mhm.
Um, and it's a conglomerate. People in that driver's seat have a different mindset than the people on the ground. So I don't know.
I agree. I agree. Part of the reason why I'm a legal nurse.
Okay, good thinking. Good thinking.
Yeah.
So we were just talking about, the disconnect and the insecurity and stuff like that, and all of these toxic conversations sometimes around nursing. What advice would you give to someone who wants to be a nurse?
I would say pursue it. I would say envision how you want your career to look and take the steps that you need to take to get there. Find people that are in the place that you want to be, talk to them about how they got there, find support, because I feel like now, especially with social media and LinkedIn, the resources are available. And for a long time, even when I was a new ICU nurse, people would come to me as a new grad and be like, oh, I should work med surg first. You don't have to do that. You can pick your specialty and just go for it. And I think that you shouldn't be afraid to do that.
Yeah, yeah, yeah. Um, it's as you say, there is so much other support out there
Mhm.
now. And there is so many avenues that you can go into as a nurse. I
Exactly.
mean, it's just endless. It's just
Exactly.
endless. And this view of the nurse in the dress and the cap and the stockings and the has got it was good while it lasted. It's gotta
Yeah,
go.
it's got
It's
to
gotta
go. It's
go.
got to go. I think that nursing has grown into something that I didn't even imagine when I was a new nurse. And I think that now, especially, there are so many different avenues and there are so many places that nurses are needed, like within
Yeah,
education and outpatient settings. And there's so
everywhere.
many ways you can advocate for people aside from working in the hospital.
Everywhere. There isn't anywhere that I can think of that a
Yeah.
nurse cannot be, that a
Yes.
nurse cannot be. And from my perspective, I am a 49-year RN. From my perspective, this is an exciting time to be a nurse, because when I became a nurse, really, that was the path. There were
Mhm.
very, very limited paths,
Yeah.
right? So to be coming into the profession now, forget all that you hear. It is vast. You
Yes.
can do anything.
Yes.
You can
Yeah.
do anything.
It's it's a good career.
Yeah, yeah. What would you say though is the most, if you could tell me in one word, what is the most essential quality of a nurse to you? What would that word be?
I think it sounds so like cliche, but I think empathy or compassion are still kind of core values of
Yeah.
nurses, because that can translate into so many different avenues, because patient advocacy and education, I feel like, are all tied to that. And those are really important.
Yeah, yeah. I don't know how you can be successful. You can do the tasks,
Right.
but how you can be successful and really make an impact without those two things, I
Right.
don't know. I don't know.
And I think just learning how to critically think and problem solve and understand the reason why someone is behaving a certain way, regardless of the setting,
Mhm.
is also tied to empathy. And I think if you can do that, then that's just going to make you a better nurse.
Exactly. 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 We're talking a lot. The other thing we're talking a lot about these days is self-care.
Yes.
What does it mean to you?
For me, it's really simple. I love to exercise. I love to be outside. I love spending time with my kids, eating good food, getting sleep, which I don't really get much of anymore because of my kids. But just really simple things. Going for a good hike, like just being able to decompress, talk to other
Yeah,
people in the field if you're having a hard time with something difficult that you faced at work. No,
yeah, yeah.
nothing too
Gotcha.
complicated. I think the simpler the better.
Nothing too complicated, she says. That is that what you just said that you said is a simple thing. Actually, is really a big thing. Being able to just do what you want to do. So often we don't get the opportunity to just do what we want to do, just do what replenishes us. So
Exactly.
that's a huge thing.
Exactly. It's easier said
So
than done.
it is easier said than done. It is easier said than done because I think that in when I think about this, I think that as females, as nurses, as mothers, it's innate somehow in us that we put everybody else first.
Mhm.
And actually putting ourselves in the equation requires effort.
Yes, it absolutely does.
It doesn't just
It
happen.
does.
It
I agree.
requires effort, no? So it's a big thing. It's a big
Yeah.
thing. Yeah. So, what do you think you see in about 10 years or so? What would you like nursing to look like?
I would like to see some of the deficits in healthcare improve. I would like to see, education improve. I would like, I don't know, I guess nurses to just feel empowered to speak up to make
Mhm,
changes within their
mhm.
fields and, speak up if they see things that aren't working and work on
Yeah,
improving them. I think the
yeah.
nurses are really good at that, and I think we just need to feel like we can do that in any
We can
setting.
do that. We can do that. We can do that. For so long, it's kind of like some kind of an oxymoron kind of thing. We claim the space of being the backbone of healthcare, which we are.
Mhm.
And then we allow other people to move us around this chessboard, like I don't know, with pieces, other aspects of other parts of the healthcare community to move us around. And
Mhm.
we have what it takes to be at the forefront of this, to be at the forefront of change. And I'm so encouraged as I look at nurses and I speak to nurses and nurses like you who are doing all kinds of things. What I know in my heart is that it may take a little time, but we're going to take this over. I
Yes,
know it.
there are enough of us that I
There
think.
are enough of us. There are enough of us, and we have reached. I'm beginning to say that we are reaching. We're fast approaching critical mass, where
Mhm.
we're saying we're not taking this anymore. We came into the healthcare arena because we wanted to take care of people, not
Mhm.
because we wanted to be abused, not because we wanted to be underpaid, not because we wanted to be moved around like chess pieces. And we're going to take care of people, and we're
Right.
going to do it in our terms.
Yes, absolutely. Well said.
I see that happening. I see it. I just want to be around long enough to see it happen. And I'm like,
Yeah.
yes. Before we go, Valerie, is there any gem, any last words you'd like to leave us with?
Oh, I don't know. Um, in terms of like for nurses or
Anything you'd like to say?
I just hope that new nurses can be empowered, you know,
Mhm,
and be motivated
mhm.
and find their place within the field and find their people to support that. So
Yeah, yeah,
resources are out there, and I think that we have the means to be able to seek them out.
yeah, yeah, yeah. We live in an age where that is entirely possible,
Yes,
entirely possible. So,
yes.
thank you so much for this conversation. It's been
Thank
really great.
Yeah,
Thank
I
you.
really appreciate you. Thank you so much for having me. I appreciate you.
My pleasure. My pleasure.